Welcome. Today we're diving into a fascinating and somewhat mysterious digestive disorder, tropical sprue. This condition, primarily found in tropical regions, can severely impact nutrient absorption and overall health. Join us as we explore its causes, symptoms, diagnosis, and treatment. The exact cause of tropical sprue remains elusive, but the leading theory points to bacterial infection in the small intestine. It's believed that these bacteria, perhaps acquired through contaminated food or water, disrupt the normal balance of gut flora. This imbalance then leads to chronic inflammation and damage to the lining of the small intestine, specifically the villi, hindering their ability to absorb nutrients effectively. Now, let's delve into the pathophysiology. Healthy small intestine villi are finger-like projections that greatly increase the surface area for nutrient absorption. In tropical sprue, these villi become flattened or even disappear, a process known as villus atrophy. This atrophy reduces the absorptive surface, leading to malabsorption of vital nutrients like fats, carbohydrates, proteins, vitamins, and minerals. The inflammation also affects the enzyme production in the small intestine, further compounding the malabsorption problem. Tropical sprue is predominantly found in tropical regions, particularly in the Caribbean, Central and South America, Southeast Asia, and parts of India and Africa. Travelers to these regions, as well as long-term residents, are at risk. The incidence varies depending on location and hygiene standards, but it's crucial to be aware of the potential risk if you're traveling to or living in these endemic areas. The signs and symptoms of tropical sprue can be quite varied and often develop gradually. Common symptoms include chronic diarrhea, abdominal cramps, fatigue, weight loss, and loss of appetite. Due to malabsorption, individuals may also experience symptoms related to specific nutrient deficiencies, such as anemia from iron or folate deficiency, bone pain from vitamin D deficiency, and neurological issues from vitamin B12 deficiency. Other symptoms may include edema, glossitis, inflammation of the tongue, and chylosis, cracking at the corners of the mouth. Diagnosing tropical sprue can be challenging as the symptoms often overlap with other digestive disorders. The diagnostic process usually involves a combination of tests. Stool tests are performed to rule out other infections and assess fat malabsorption. Blood tests are conducted to check for anemia and vitamin deficiencies. However, the gold standard for diagnosis is a small intestinal biopsy. This involves taking a tissue sample during an endoscopy and examining it under a microscope to look for villus atrophy and inflammation. The hallmarks of tropical sprue. A Schilling test may also be used to assess vitamin B12 absorption. While there aren't distinct types of tropical sprue in the traditional sense, the severity and presentation of the disease can vary significantly from person to person. Some individuals may experience mild symptoms, while others suffer from severe malabsorption and significant weight loss. The specific nutrient deficiencies that develop can also differ, leading to a range of clinical presentations. Treatment for tropical sprue is primarily focused on eradicating the underlying bacterial infection and replenishing the lost nutrients. The mainstay of treatment is a course of antibiotics, typically tetracycline or doxycycline, for several months. In addition, it's crucial to address the nutrient deficiencies with vitamin and mineral supplements, including folate, vitamin B12, iron, calcium, and vitamin D. Dietary modifications, such as a gluten-free diet, may also be recommended to help manage symptoms and promote healing of the small intestine. Unfortunately, preventing tropical sprue completely is difficult due to the uncertain etiology. However, several measures can reduce the risk, especially for travelers. These include practicing strict food and water hygiene, such as drinking only bottled or boiled water, avoiding raw or undercooked foods, and washing hands frequently. Avoiding areas with poor sanitation can also lower the risk of exposure to potential pathogens. The prognosis for tropical sprue is generally good with timely diagnosis and appropriate treatment. Most individuals experience significant improvement in their symptoms and nutrient absorption within a few weeks or months of starting antibiotics and supplements. However, long-term follow-up is necessary to monitor for recurrence and ensure continued nutritional support. Recent research is focused on identifying the specific bacteria involved in the disease and developing more targeted therapies to prevent and treat tropical sprue more effectively.